Thinking about getting a procedure done, there are 3 different types of anesthesia types that you should be aware of. Number 1 is local. This is when you're fully awake. Imagine it's kind of like when you're at the dentist. Well, they inject some numbing medicine while they perform a procedure. Now, this can actually be done very effectively on small areas. Some people can do larger operations under local. I don't like to do that because it's always hard to keep a patient fully pain-free when you're doing a large area of, say, like liposuction. There are certain procedures you definitely don't want to do under local, like a tummy tuck or breast augmentation. They're just way too invasive and very painful. Do not recommend to do that at all. But a great example of what can be done under local is a small little molar removal or skin tag excision, or even like a scar revision. Okay, those are great things that you can do under local. Also, ear surgery can be done under local because you can completely anesthetize the ear. There are some side effects with local administration. That's why you don't want to use too much lidocaine, because it would be cardiotoxic. Lidocaine is what actually numbs up the area. There's also epinephrine in it typically, and that constricts the blood vessels, all right? So this can be done without anybody having to kind of pick you up. You come in, you get your procedure, you get the numbing medicine. It typically wears off in 1 to 6 hours, depending on the type of numbing medicine you get, and then you go home and you're good to go. And then once the numbing medicine wears off, you can have a little bit of pain, and then you can take a pain medication at that particular point. Now, next step is conscious sedation, all right? This is kind of a anesthesia that's given on IV, typically propofol or other medications or a combination thereof, and you are going to get a procedure where you're partially kept awake. All right, but you don't remember anything. Your body, you're pretty much kind of snoozing while this is being performed. Okay, a lot of facelift procedures are done for this. This is great for older people that don't want to take the risk of the full-on anesthesia. Okay, and it's great for kind of in-between procedures where you don't need to actually completely paralyze somebody. All right, when you need to paralyze somebody, that's when you need to go to full anesthesia. Why would you need to paralyze somebody? So, like if you're doing any muscle work or major bone work, paralyzing and intubation or with a laryngeal mask airway is kind of the way to go. That way the surgeon has full control over everything and doesn't get any resistance from your body, and you are completely out of it, snoozing away, not feeling a darn thing. It's a combination of IV medication and gas that completely knocks you out. It can be a risk for some cardiovascular complications, right? So if you're older, you have heart conditions, you can have a heart attack and so forth. So for a younger person, this really isn't a bigger deal, but if you're older and you have a heart history or if you have heart problems, you may want to look at conscious sedation as more of an option for your surgery. That's it for the 3 different types of anesthesia. If you have questions about it, leave it right down here in my comments questions, and I'll get back to you. If you like what you saw today, give me a thumbs up and hit subscribe. Thanks for watching.